So this is a surgical cap that we're just starting with. So I've still got to add the ties to it. And I've got to add a second layer on the inside. So the masks, the pattern I'm making is 2 levels. It has 2 sides so that a filter can be put in here if that's what they require. And then it's made with ties, and the ties are so that they can be adjusted better. It's also got pleats in it so that the pleats can go from the nose to underneath the chin. Our disclaimer certainly is that this is by no means a medical grade mask. We were doing these in case it got to a situation where they really needed them and something was better than nothing.
But with hospitals across the country showing concern over the supply of face masks and other protective equipment, a community group has been put together to try to sew fabric face masks from their homes. And they have had more than 2,500 requests for masks in just 4 days.
It's called Ontario Sews. It started out on Sunday night actually as Durham Region Sews, but now it's called Ontario Sews. This is a little bit of what I can do to give back, and I think the rest of the group feels the same way.
They want to emphasize that these masks are not replacements for professional medical equipment like N95 masks and other respirators for frontline staff, and they have not been shown to provide protection against COVID-19. However, some healthcare officials are applauding the effort. Dr. Asad Mashari from Toronto General Hospital and the University of Toronto says the masks can be useful for protecting others from the person wearing them by catching any droplets, and to a lesser extent as protection for the wearer. He says this is a great effort and much needed.
They still need to be sanitized and they get pressed, and then when they get to they have a label. Each one has a label of what types of fabrics it is. We have a legal disclaimer that goes with them as well, and then they also get sanitized again when they get to the area to wherever they're going.
The group says they have already had requests from nurses, long-term care facilities, and even inquiries from hospitals. And more people are joining the sewing effort each day.
The group really grew from that into, there's over 600 people in the group now that are all helping. We are just having hundreds of people join every day right across Ontario. So Leanne's even mobilizing different areas. So we're helping out Port Perry at the moment. We're helping out London, Ontario, Kingston. So there's a whole bunch of sewers that are all coming together. So I'm hoping we can get some more sewers to help out as well.
Healthcare officials say if these are to be used, there are certain things the wearer should keep in mind. For example, they would need to be washed frequently and should not come into contact with other things after they have been worn.
It is distressing, but I think maybe right now it's just because it's all rolling out, right? So we're hoping they're not going to use them, that they're going to have the equipment that they need.
Well, they are looking for more volunteers to help sew masks, but also people to volunteer to help sanitize and deliver. For information on how to help and to find patterns for the face masks, you can go to our website, citynews.ca/extras. In Toronto, Audra Brown, City News.